Welcome to this video, which is designed to explain what PIFU is and when and how it might be used, together with explaining how to order it through the Cerner system. I'm Chris Garnder, a consultant paediatrician, and I'm going to explain some of the benefits of PIFU and how it can be useful in clinical practice. There have been lots of worries about the use of PIFU, which stands for patient-initiated follow-up. However, the use of this tool is actually vital in ensuring patient safety. In a system which is struggling with capacity, there is a potential risk to patients who are sitting on waiting lists for follow-up, sometimes deteriorating, without this information being known to the treating team. PIFU works on the principle that the person who is most invested in getting their care right is the patient themselves. Involving the patient, therefore, in the decision as to when further medical input is required within agreed parameters is actually the safest way to manage this situation, as this ensures that patients who are in clinic having follow-up for known conditions are actually requiring medical input and empowers the patient to let their treating team know if there's been a change in their clinical condition. In many services, patient-initiated follow-up is already happening. However, it's often through informal channels, and this makes it really difficult to plan capacity, as we don't have any way of monitoring how many patients are seeking to expedite their appointments or returning when they've been discharged from services. Patient-initiated follow-up is therefore a key part of both our attempts to reduce waiting lists and a key part of our compliance with the NICE guidance on shared decision-making. It's really important, however, that we record this appropriately so that we can plan capacity and end up with our patients getting services at the right time in the right place. There are two types of patient-initiated follow-up. The first is where we believe that a patient's condition is self-limiting and should resolve. This is known as PIFU discharge. In this situation, we would not arrange further follow-up at the hospital, but counsel the patient that we believe the condition will either resolve or remain at a level where it can be managed in primary care. We do, however, invite the patient to contact our service back directly should certain events happen. One example of this might be a patient who has had what was felt to be a self-limiting seizure, and that they were counselled that they won't receive further follow-up. However, if they have a further seizure within a set period of time, they can contact the service directly in order to have further review. At the end of this period, however, if they haven't made contact, they will be automatically discharged back to their GP. This is an efficient use of follow-up capacity, as it ensures that patients are seen at the point where an event happens, but also reduces pressure on primary care in this situation where it's agreed that a patient would automatically require referral back, thus saving the GP time as well. Use of the PIFU pathway allows us to monitor the number of patients who do return and allows us to plan our clinic capacity accordingly, reducing the need for clinic overbookings and delays. The second type of PIFU is known as PIFU moved, and this is to be used where a patient will require an intervention such as face-to-face follow-up, blood test monitoring or diagnostic screening at set periods, but in between the set events, you would wish the patient to contact you if they have an exacerbation in their symptoms. In this situation, the patient will be placed on the PIFU pathway at an interval to be determined by the clinician. However, at the end of this pathway, they would be added to a work list for action rather than discharged. An example of this may be where a patient needs annual telephone follow-up, but they need to contact the service before this if they have a concern. The PIFU pathway is scheduled, and the patient invited to contact at any point within the year if they have a flare-up of symptoms. However, if they've not contacted at the end of the year, they will then appear on the holding list ready for a telephone follow-up to be made as planned. Again, this is a safe method of following patients up, as they're invited to contact us directly if their condition changes. However, they can still receive their annual screening if their condition is stable. It's important when using this type of PIFU that there are arrangements available within your directorate to monitor the work list and ensure that the routine appointments are scheduled at the given interval if the patient hasn't made contact. We're now going to go on to demonstrate how PIFU can be made quickly and efficiently through Cerner, including the use of favourites, which can make this a very quick process to arrange with very few clicks.
In this video, I will show you how to add a patient to a PIFU list and how to amend this if required. Hover over the menu on the left-hand side. This can be pinned if required by clicking the pin icon. Select Request, Care Plans. Click the Add button to begin your request. Start by typing in the specialty required. For this example, I will be using derm. Select the follow-up matching the specialty specified. Click Done to complete the order details. All the mandatory fields need to be filled in before completing the order. The schedule within box must be completed, specifying the time frame the patient needs to remain on PIFU. In the Type of Follow-up box, select the type of PIFU required. Guidance on this is available in the first part of this video. Use the comments box to add any additional information. At this point, the PIFU order can be saved as a favorite. This allows you to place an order faster and with less clicks needed. To do this, right-click the order at the top of the screen. Select Add to Favorites, then click OK. How to access this will be shown later in the video. To complete your order, click Sign. Click the Refresh button in the top left to complete your order. The order is now available to track within Request, Care Plans. This then moves on to the next stage where the admin staff will monitor the PIFU lists and action when required, as detailed in the PIFU SOP. If the order needs to be amended, this could be to change the type of PIFU or the scheduled time frame. Right-click the order and select Cancel Reorder. Amend the required details on screen. Once completed, click Orders for signature, then click Sign. The order has now been amended. To use the favorite created earlier in this video, repeat the previous steps. After clicking the Add button, select the favorite folder. Here you will see your PIFU request. Click on this to proceed. Amend any details as required, and again complete the order by clicking Sign.
It's important that clinical teams review their pathways and identify particular pathways which may be suitable for PIFU to be used. There are many resources relating to this on the Getting It Right First Time website and through the NHS Futures website, and please do contact Chris Garnder, myself as the GIRF Clinical Lead, or Joe Lishman, our PIFU Lead, for the Trust if you need more help.